what's wrong with modern medicine? We're all living longer, right? Seems to be great. Well, if you're watching this video, you probably have an idea that maybe it's not so great. So I'm going to give you an example, and the example will illustrate some of the problems. In my case, I've had 2 herniated discs in 3 months. It's a serious problem. There's something wrong with me. Probably maybe some postural issue. I don't know. Something wrong with my spine. The first time, I saw 5 doctors before I could get an MRI. Why? Because the first 4 didn't want to give me an MRI. And why not? Why would the doctor not want to know what's wrong? I say, doctor, there's a problem with my spine. I want to know what's wrong. Why would the doctor not want to know? Why would the doctor say, oh, just take some of these medicines and maybe you'll feel better? I'm not interested in simply hiding the notification that there's something wrong. That's what pain is. It's a notification by the body to your brain. It says, ow, something's wrong. That's so you can have awareness of it. I'm not interested in closing my eyes to the awareness of a problem, so to speak. I want to know what the problem is. Once I know what the problem is, then I can figure out how to address that problem. This is basic troubleshooting skills. Doctors don't have it. What doctors have is a very high barrier to entry, and they have a situation where they have to make money and they appease to the insurance companies. Insurance companies have to pay. They don't want to. So the insurance companies try to avoid paying. So we get a situation where the doctor has to appease the insurance companies don't want to pay. So the doctor says, well, instead of trying to figure out what's actually wrong, well, let's just tell you that you're probably fine and give you some muscle relaxers or painkillers, or tell you to take a high dose of some other medication that will have side effects and mask the pain. Okay? This doesn't help the problem. If there's a problem with my spine and I also have a neuromuscular problem, prescribing prednisone is not going to solve the problem. What it's going to do is cause all the side effects that prednisone is known to cause. And those are easy to find. It includes psychological problems, mania, depression, problems with the endocrine system such as depressed hormone levels, and wasting of neuromuscular and connective tissue. Wow, so I've got a problem with my muscular system, and I should take something that is causing that to become worse as a side effect. That's a great solution, right? No. First, let's try to figure out what's actually fucking wrong. How about that? Let's figure out what the fuck's wrong with the patient first. Well, the doctor could probably do some diagnostic tests by putting their hands on you. Most of the time, they don't really want to do much of that. They're very limited in their skill and ability to do that. And why? Well, if you ask the doctor, they'll say, the first course is to put you through physical therapy. Actually, the first course is really to, the first thing they'll do is they'll try to give you some painkillers, some non-steroidal anti-inflammatories, and take a rest. For that, they'll give you a bill. You have to go down there, wait, make the appointment, wait, take your time out of your day, and wait so that they can do step 1, which is, oh, you should take some ibuprofen. You'll probably feel better after that, right? You have to pay for that. Hundreds of dollars goes into that. Really. So this is why healthcare is expensive. We have all this bullshit by people who are supposed to be professionals and experts in health. They're participating in this bullshit for a massive profit. They're rich. Doctors make a lot of fucking money. Okay, doesn't matter if you don't have to pay that much out of pocket. They're still making a lot of fucking money for bullshit. Eventually, somebody's going to have to fucking pay for it. It goes through, a lot of times, government has to pay for it. And where does government get money? It gets money from people who are working. People working, pay taxes, pay for the government, to pay for bad medicine. So, that's their step 1. What is their step 2? Step 2 is maybe they'll give you physical therapy. Now, that can be useful. Can be. But first, we need to know really what's wrong with you. before getting an MRI, they want to give you physical therapy. So what's the problem? If they don't know, they can only guess. And as I said before, their physical diagnostic tests are generally very poor. Okay, and I say this after having had misdiagnosed or failed diagnosis for a ruptured herniated disc in my low back, pushing fluid out onto the nerve. They failed to diagnose it. They just didn't know. They couldn't recognize that, despite all the symptoms. You can Google it. Herniated disc with extrusion. All the symptoms there, I told the doctor about. They couldn't put two and two together. They couldn't get on Google. They were too arrogant to even get on Google. Which I'm not arrogant because I don't have anything to. I have no ego about this. I'm just trying to figure out what the fuck's wrong with me. Why does it hurt when I sit down in the toilet and try to push and my back hurts? What's wrong with me? I don't know. I have to figure it out, so I have to get on Google. Doctors don't want to get on Google. No, because they're experts. Okay, that's one issue. Another issue I had, let's see, I went to a doctor with a torn anterior cruciate ligament. Yeah, I snapped the ACL right off the bone. I don't fuck around. And the doctor couldn't figure it out. And I said, no, I'm pretty sure I tore my ACL because I had a lot of symptoms. Couldn't figure it out. I said, no, I want you to get a second opinion right now because this is something I want to get treatment for. Couldn't figure it out. Eventually, he became so frustrated that he called security to tell me to leave. Now, mind you, I was super calm the whole time. Why? I don't know. After having my ACL torn, I was just chilling in the doc's office, telling him, yeah, this is a problem. So, that's number two. Another third problem. Herniated disc in my neck, C5, C6. First doctor, couldn't figure it out. Second doctor, couldn't figure it out. Went to the emergency room, went to acute care, went to an orthopedist. The fifth doctor was finally able to figure out, oh, looks like you might have a herniated disc. Okay, so this is what they do. The doctors are stupid, they charge too much, that costs a lot of money, the patient doesn't get treatment. This is why things need to change. So what is really the solution to this? I think the best solution to this is to find any hacking ways around the healthcare system so that patients can treat themselves. In fact, it's already happening. We can see this because we see a lot of research chemical sites which are promoting things like TB500 and BPC157. Now, there are a lot of people out there injecting themselves with bullshit that they bought off shady research chemical company sites. Why do they do this? Because they don't know what the fuck else to do. They go to the doctor and the doctor says, maybe you pulled a muscle. Why don't you try taking some Advil and rest a little bit and see how you feel tomorrow? Yeah, so people know this. People know the doctor's bullshit. They're not going to fucking help. The doctor's just going to take a bunch of money and it's not going to fucking help. So what do? They try to figure out how they can solve the problem on their own. And they do this by buying shit online. There's definitely problems with that because when you're injecting some bullshit you bought off some shady research chemical company site, you don't actually know exactly what the fuck it is, nor do you know if it's going to be really safe. So it's a big risk. And that risk comes with a cost. The cost is potentially your health. But given if you are already in a health compromised situation, some people will take that risk. They'll take that risk and they'll do it. The way that the problem, the healthcare has to be solved is so that the doctor can really be more effectively controlled, if not entirely usurped. And nowadays, patients have so much information available to them via the internet that it becomes much easier to self-diagnose. It's not perfect. Of course, there are many things that we won't be able to figure out. But since patients are not arrogant, unlike doctors who generally are arrogant and unskilled or stupid, we can actually sit down and say, okay, let's try and figure this out. What's wrong here? Where the doctor is just going to read line 1, take Advil. That's what's wrong with the healthcare system. Basically, in a nutshell, the doctors are stupid and don't help. Patients don't get the treatment that they need. Patients don't get better.